Welcome back to the Bipartisan Brief. I'm your host, Peter Schwedhelm, and today we're going to be talking exclusively about COVID-19. We're going to begin internationally, and we're looking at three statistical categories primarily. That's testing capacity, new cases, and new deaths. And we're looking at only countries that have a population north of 10 million and confirmed cases north of 1,000. Throughout our COVID coverage, we're going to be comparing 2 weeks ago versus the week most recently passed, and we're also going to be taking a look at where things currently stand. The 10 nations that had the biggest increase in testing capacity over the last 2 weeks were Haiti, Morocco, Bolivia, Nepal, Iraq, Uzbekistan, Ethiopia, Bangladesh, the UK, and Indonesia. And it's really encouraging to see that the so-called third world countries are stepping up to the plate and increasing their testing capacity because, of course, you can't meet this challenge if you don't have good data. The 10 countries that increased their testing capacity the least were Guinea, Guatemala, France, Egypt, Sudan, Mali, South Sudan, Venezuela, Tunisia, and Czechia. And of course, France jumps off that list because it almost makes it seem like their leader is trying to suppress the case numbers to help himself politically. It's absurd for a nation as wealthy as France to have not increased testing capacity in the last 2 weeks at all. And then the other country that jumps off the page, of course, is Venezuela, because they're having so many problems as it is. And on top of that, they're doing an inadequate job with COVID testing, which means that the pandemic there is, of course, much, much worse than it seems by the numbers. The countries that saw the biggest decrease in new cases, averaging the daily new cases from 2 weeks ago versus last week, were Malaysia, Sri Lanka, Tunisia, Australia, Kazakhstan, Cameroon, Canada, Iran, Sudan, and Japan. And what's noteworthy on that list, in my opinion, is that Japan, Tokyo's got heavy population density, and they saw a bit of a second outbreak, and it looked as though it could get out of control there. And yet now, over the last 2 weeks, their cases are being managed much better, and the numbers are actually going down. And then the other one is Iran, because of course they were devastated. They were one of the first countries with the healthcare system overwhelmed, and it was really ugly there dealing with this. And so to see Iran have their new case numbers going down over the course of the last 2 weeks is very encouraging as well. The 10 nations that saw the biggest increase in new cases over the course of the last 2 weeks were, as a percent, were Zambia, Greece, Iraq, Ivory Coast, Saudi Arabia, Indonesia, Uzbekistan, Dominican Republic, Morocco, and Pakistan. And of course, the country that jumps off the page first is Greece, so I need to point out they only had 20 new cases on Friday. So as a percent, things are going in the wrong direction, but their total caseload is still extremely manageable, and that government has done about as good a job of anybody as meeting this crisis. And then the other country is Iraq and Indonesia. Iraq because, of course, it's war-torn. And the fact that their cases are going the wrong direction, it's a little bit like Yemen. It's like the last thing they need is for the pandemic to really explode there. And then Indonesia because they have so many large cities with such high population density. Anytime a nation that has major population centers where public transportation is popular and the numbers are going in the wrong direction, it has the potential to go even more severely in the wrong direction and in a hurry. The countries that saw the biggest decrease in average daily deaths over the last 2 weeks as a percent were Spain, Cameroon, Czechia, Japan, Canada, Portugal, Belgium, Germany, Greece, and the Netherlands. And Spain and Belgium jump off the page because they were just devastated. In fact, I think Belgium continues to have the highest number of deaths per million in the entire world. And so to see Spain and Belgium both heading in the right direction in terms of people dying is very encouraging indeed. The countries that saw the biggest increase as a percent in terms of daily new deaths 2 weeks ago versus last week were Malaysia, Chile, Guatemala, Afghanistan, Iraq, the DRC, that's Democratic Republic of Congo, South Africa, Ecuador, Philippines, and Colombia. And Chile jumps off the page because, one, it's going to be winter. It is winter there. And we think that while the summer hasn't hurt this virus as much as we wish it had, we think that cooler weathers allow the virus to be transmitted even more easily. And the Chilean government actually reacted to this very quickly. And the fact that they're on the list of places where things aren't going well is quite discouraging, considering what the weather's doing down there, which is going to exacerbate it, and considering the government actually responded quickly and strongly, and they're still having severe problems down there. And then both Afghanistan and Iraq, of course, war-torn countries, and just the last thing that war-torn countries need is a pandemic. We saw a decrease this week compared to last week in terms of countries where new cases were rising faster than new testing capacity as a percent. And I feel like that's where you know things are really going in the wrong direction. If new testing goes up 40% and new cases go up 30%, well, it's nowhere near as bad as the other way around, obviously, just speaking intuitively. And the nations where the cases went up faster than testing were Ivory Coast, Guatemala, Saudi Arabia, Ecuador, Greece, although again, Greece has very low total cases, Dominican Republic, Azerbaijan, Indonesia, Poland, South Korea, Egypt, and Czechia. Very concerning to see South Korea on this list because, again, that was a government credited with doing an amazing job. And anytime that new cases are rising faster than new testing capacity, there's just no way you can look at that and say the government's actually, in fact, doing a great job. And then also concerning is that most of those nations are in the developing world. And there's been widespread expectation and prediction that we're going to see this thing explode in the developing world in the coming months. And so to see numbers like that is quite discouraging. There are also quite a few countries where both new cases and new deaths are going in the wrong direction, comparing this past week versus 2 weeks ago. And those countries are Colombia, Bangladesh, India, the Philippines, Ukraine, Pakistan, Indonesia, Argentina, South Africa, Uzbekistan, Azerbaijan, Dominican Republic, Ivory Coast, Chile, Guatemala, Iraq, Ethiopia, Ecuador, and Saudi Arabia. And of course, all of those nations being in the developing world makes it additionally concerning because they're not going to have the resources to meet the challenge in the way a nation like the United States does. There are also, fortunately, quite a few countries where new cases and new deaths were both going in the right direction, going down. And that's Sudan, France, Italy, the United States, Venezuela, Germany, Sweden, Japan, Canada, the UK, Haiti, Spain, Tunisia, Sri Lanka, Cameroon, Somalia, and Algeria. So there's a mix of the developing world as well as wealthier nations. And in my opinion, there's really no excuse for any wealthy nation to not be going in the right direction due to the tremendous advantage in resources that wealthier nations have. Now taking an overall look at the data of new testing and new cases and new deaths and looking at them together, the 10 nations that had the best week compared with 2 weeks ago were Sri Lanka, Tunisia, Thailand, Spain, Haiti, the UK, Canada, Bolivia, Japan, and Sweden. And Sweden being on that list is very interesting and is certainly going to provoke conversations because the so-called Swedish model of observing social distancing guidelines but not having a shutdown with the hopes of reaching herd immunity in a controlled way. It looks as if at this moment that strategy seems to be working rather well, although their death rate per capita, it should also be noted, is substantially higher than any of their Scandinavian neighbors. And the 10 countries that had the worst week compared with the previous week, looking at percentages, were the Ivory Coast, Chile, Guatemala, Iraq, Senegal, Ethiopia, Malaysia, Saudi Arabia, Ecuador, and Greece. Greece, again, still has a very manageable caseload, but everything's trending in the wrong direction in Greece as it is. And so we hope that they are able to get things back on the right track. And then you obviously have to look at Iraq. It's, again, super concerning that a war-torn country has everything going in the wrong direction because they're going to be just completely unable to meet the challenge because they've been meeting so many other challenges that their resources are incredibly depleted. And then most of the other nations on that list are developing nations. And same situation, you need resources to fight this. And it's sad and troubling to see a lot of some of the very poorest nations in the world to be on this list where things are going very badly at the moment. Now shifting our attention to the United States of America, again looking at the 72 nations comparatively, the United States ranks number 1 in total cases, number 3 in total cases per capita, having just recently surpassed Spain, number 1 in total deaths, number 7 in deaths per capita, number 1 in total testing capacity, and number 7 in testing capacity per capita. Now, looking at the USA did this past week compared with 2 weeks ago, relative to those other 71 nations on the list of countries we looked at, we were number 27 in testing capacity increase, which is 38th percentile. We're number 28 in the change in new cases in a positive direction in the 39th percentile. We're number 22 in the change in new deaths, also in a positive direction in the 31st percentile. And we're number 16 overall, comparing those three factors together, which is the 22nd percentile. While it is, of course, good that both new cases and new deaths trended in the right direction for the United States, comparing this past week with 2 weeks ago, it should be noted that the U.S. is in the top 10 in total cases, cases per capita, deaths, and deaths per capita. But we're not in the top 10 in terms of the testing capacity increase, 27, the positive change in new cases, 28, positive change in new deaths, 22, and overall, 16. Now looking at the states, the 5 states that increased new testing capacity the most over the course of the last 2 weeks were Vermont, Wisconsin, Minnesota, Mississippi, and Michigan. And Michigan jumps off the page because they sort of got over the hump with the worst of it, but they're still fighting to increase testing capacity as quickly as possible, which to me shows responsible leadership. The 5 states that increased their testing capacity the least were Rhode Island, Pennsylvania, Washington, Utah, and North Dakota. And in the case of Rhode Island, Pennsylvania, and Washington, it's very concerning because they've all been hit hard. And I don't know how states that were hit hard could possibly take their eye off the ball in terms of testing. The 5 states that decreased the average of daily new cases the most over the last 2 weeks were Illinois, New Mexico, Colorado, Rhode Island, and Massachusetts. And obviously Illinois, Rhode Island, Massachusetts all got hit extremely hard and are still struggling. And so it's nice to see those numbers going in a positive direction. The 5 states that saw the biggest increase in new cases were Nevada, Vermont, Alabama, Oregon, and Wyoming. And what's concerning there to me is that Nevada and Alabama are both warm weather states. And again, we were all hoping that the summertime was going to really slug this virus in the gut. And so far, that's not happening as much as we all were hoping it would. The 5 states that saw the biggest decrease in new deaths over the last 2 weeks were Louisiana, West Virginia, Maine, North Dakota, and Wyoming. And in the case of Louisiana in particular, they got hit so hard, it's really good to see those numbers going the right way. The 5 states that saw the biggest increase in average daily new deaths as a percent over the last 2 weeks were Tennessee, Utah, Oregon, South Dakota, and Idaho. And what's concerning there is there's a lot of rural areas which have not been hit as hard. And I think we were all hoping that they wouldn't be. And it looks like, based on these numbers, that this thing has now arrived in full force in rural areas. The 5 states did the best overall, comparing the 3 points of data that we looked at, were Connecticut, Colorado, West Virginia, Maine, and Massachusetts. And in the case of both Connecticut and Massachusetts, again, they got hit really hard. So it's good to see things trending positively. The 5 states that were the worst by the numbers over the course of the last 2 weeks were Utah, Nevada, Alabama, Oregon, and Idaho. And in the case of Alabama and Nevada, again, those were warm weather states, so we were hoping that COVID-19 would struggle a lot more than it seems to be in the warmer weather climates. There were 20 states in the U.S. where we saw positive trends in terms of both new deaths and new cases. And that's Indiana, Pennsylvania, Iowa, New Hampshire, Louisiana, Wisconsin, Virginia, New Mexico, New York, Rhode Island, Maryland, Connecticut, Colorado, West Virginia, Kentucky, Ohio, Minnesota, Connecticut, Maine, Massachusetts, and Montana. And we also had 12 states, unfortunately, where this was trending negatively in terms of new cases and new deaths, comparing 2 weeks ago with the week most recently passed. And that's Oregon, Alabama, Nevada, Utah, South Dakota, Arkansas, Tennessee, Georgia, South Carolina, Oklahoma, Arizona, and California. And again, when you're looking about Alabama, Nevada, Arkansas, Tennessee, Georgia, South Carolina, Oklahoma, and Arizona, those are all warm weather states. There are also 10 states, which is way too high, where new cases are rising faster than new testing capacity, which again, to me, is deeply troubling. And those are Oregon, Alabama, Nevada, Arkansas, South Carolina, Oklahoma, Florida, Wyoming, Vermont, and Hawaii. In the case of Hawaii, they still have very low overall numbers, but it's really important that the governors not take their eye off the ball when it comes to testing. Everybody needs to be testing as many people as we possibly can, and as many places as we possibly can, in as large a numbers as we possibly can. And now it's time for the partisan scorecard, as this is a political show. Democrat-led states were mentioned 23 times in a positive sense and 16 times in a negative sense. Republican-led states were mentioned 16 times in a positive sense and 28 times in a negative sense. 59% of the positive mentions were Democrat-led states, and 41% of the positive mentions were Republican-led states. 64% of the negative mentions were Republican-led states, and 36% of the negative mentions were Democrat-led states. And now that we've finished the partisan scorecard, we're going to go to a pair of COVID-19 related interviews. I'm joined today on the Bipartisan Brief by Helen Loeffler, who's a midwife based out of Baltimore. And because this has been kind of an all hands on deck approach with the COVID-19 crisis, even though she's technically a midwife and wouldn't ordinarily be directly involved, she's been volunteering and she's been involved based on the circumstances. And I'm curious, Helen, first of all, thanks for joining us. And second, tell us a little bit about what you're seeing with your own eyes. Help fill us in from somebody that's got direct information and direct knowledge.
And our hospital was definitely harder hit than some of the hospitals in our area. But fortunately, we seem to be past our peak and moving down. So every day I check the numbers and I'm grateful to see them dropping, which has been great. I'm just sort of bracing for the next peak, which I feel like is inevitable, unfortunately.
Well, so you're not working directly with COVID patients, but you've been affected directly based on the fact that your hospital is doing deliveries and also treating COVID patients.
And labor and delivery is a unique area that hasn't quite gotten much attention, except little bits in the news about how policies have been affected. From the hospital standpoint, you might have heard a lot about how hospitals have closed off elective procedures and are trying to kind of keep people out of the hospital as much as possible, at least temporarily, to flatten the curve and to create space for expanded ICUs and things like that. But the people still come in labor and still come in with pregnancy problems. So similar to an ER, labor and delivery units are, they're acute care settings. People walk in off the street and it doesn't matter whether you ask them to come in or not, they're coming in, and you don't necessarily know if they're coming in also with a virus, even if that's not why they're coming in.
How overwhelmed was the system? How devastating is this disease? Are people coming in? I've been told that a friend works in ERs in New York City, and he said he'd never seen anything like it in his life.
Right.
That just the extent of this disease being contagious and things like that, and just the rapid pace with which hospitals found themselves, if not overwhelmed, on the brink of being overwhelmed. And so I'm curious to hear some stories and also learn exactly how close you guys were to the brink. Like, for example, in Mexico City 3 weeks ago, but before the government stepped in and dedicated the majority of the large hospitals in Mexico City are now COVID-19 only. Right. So they've specialized, so to speak. So births are happening outside of the major public hospitals. But before that, they were so overwhelmed, they were sending people home. People who were desperately ill. They were just sending them home to die. And I don't think that happened in the U.S. much, to my knowledge. But it definitely happened in other countries. Just help us understand how close was this situation to becoming that?
In the early weeks where we were coming to, realizing that we needed to change things, it was almost the most stressful period because, I would see what was happening in New York and what epidemiologists were recommending, and we weren't quite implementing it yet. The masking and the canceling certain kinds of appointments and screening and things like that. So once that those adjustments were made, it all started to feel better. And I think one of the things that maybe seemed confusing from the outside is how there are a lot of ways in which things were quieter in hospitals, right? So, that ER staff were sometimes finding themselves not as busy as they typically would be. And part of that continues to be an issue of people not going to ERs and being afraid to go. When I'm on call and I have someone call me with a problem that I think they need to be evaluated in the ER, I'm sometimes having to talk them into it or having them decline, and I'm telling them, here's what you got to look for. I think you have a serious infection, or I think you're bleeding too much, or I don't know what's causing your pain. You need to go, and they don't want to go. So you've seen like quieter than usual ERs, and the fact that proactive measures were taken to, in Maryland, for example, cancel elective procedures. So you're opening up all these rooms, build overflow in the convention center, which only barely got used, but they created this extra capacity. The disaster would have been if routine cases were still going on and there weren't those beds and people were still coming. So I think the cities that were able to be proactive in time before their curve hit really helped. And so I do think that seems to be the case, where I am in Baltimore. You're used to dealing with infection prevention in the patient room. You're not as used to dealing with infection prevention directly with the person sitting next to you at the computer. And so just realizing that we're all potentially harmful to each other you really felt that in the peak of it. We had staff like from my OBGYN office that had to be trained, medical assistants that work in an outpatient office, brought into the ICU. My one medical assistant I worked with this week had just returned from her time in the ICU, and she just had to be trained to learn how to take care of patients. She was terrified before she went, and afterwards she was really grateful for her experience. The staff was really supportive. I think they worked together really well. They were grateful for the help. She said that the staff was great, but just all really tired.
So it sounds like in Maryland, you guys were stressed, but not totally overwhelmed.
Right.
Which is a relief to hear. And
right.
I'm curious as well, where do you think we went wrong? You'd mentioned before in a previous conversation, for example, that some of the hospitals were following normal purchasing procedures, consequently leading to delays in acquiring necessary equipment. You'd mentioned again previously in a different conversation that you were being asked to reuse your N95 mask sort of day after day after day.
Oh, we still are.
So there's still are shortages.
Yeah, it's just the norm now. You don't, it feels like it's just the new standard of what's okay. Whereas previously you'd throw out your N95 after you had, taken care of the patient. I've been working since the start of the pandemic. I'm on my third N95.
Goodness. And
so now I'm doing, sometimes I'm there for, I've had a couple shifts where I've been in the hospital for 20 hours. We were not initially using the N95s right away, as because I'm not on a COVID unit, right? So, so initially we were only going to use them for positive people. Then the recommendation was to use them for every delivery. And then it changed to use for every patient encounter. So it was a very kind of reactive.
What was the time frame in that shift? And also why you think about that, out of curiosity, before COVID, as a midwife, were you wearing a surgical mask only during delivery, not an N95?
Mm-hmm. Yeah, I usually would wear like a mask that there's some masks that have a little face shield on it. And, and in delivery, the personal protective gear that you wear during a delivery is protecting yourself from body fluids. And as takes a little while to kind of get used to. We're wearing our gear to protect each other and staff members. So,
brand new, right?
and that's really new, right?
Right.
Like that even took a little bit of time, even in the outpatient office setting, this idea that we're wearing masks all the time, and like not just when you're talking to the patient, like also when you're talking to each other, and in the break room, we can't be near each other. You know, you sort of, because we're interacting with people and touching people, it almost kind of makes us forget that we're potentially, you know, can infect each other. So the supplies have improved, but people are still reusing. And I believe that's the case everywhere. So that story just isn't like, everyone's off that story now. We have other things to talk about, but we're still rationing for sure.
And so I'm curious as well, because as someone who doesn't work in your field, it's been concerning and bothersome and frustrating and scary to hear the recommended guidelines dramatically shift and
Yeah.
reshift kind of over and over. And so part of me recognizes that this situation is very complicated and it has very few easy questions with apparently absolutely no right answers. And so I'm trying to provide or grant at least a little bit of grace to people in leadership positions. But it is frightening when the guidelines whole cloth change. It seems almost like every other day. How do you feel about that as a medical professional?
You know, it's definitely disheartening and unsettling to experience the kind of shifts and recommendations from like an organization like the CDC,
or any
and any organ, but I'll just stick to them for a second, and just also to feel the sort of politicization of it. I mean, I'm sure that it's not unique, but it feels like a more extreme case of that, and just really also feeling a lack of transparency as well. Because, you know, as a healthcare provider, you're sort of used to having, you know, you're trained in science, and so you're used to science doesn't always have all the questions, but we tend to have the places that we go to for the best available information and the best available recommendation and some consistency in what to look for. And so, and especially among nurses, so like especially for the nursing profession, which you know, takes quite seriously things like infection prevention and the protocols and kind of, you know, sort of rules and regulations, like what PPE you would wear in what situation and how you protect your safety and the patient's safety. All healthcare providers care about that, but I feel like a lot of that is the domain of nursing. Yeah, it was sort of, we all felt like, I know you're telling us that this is okay, but we think, but probably the reality is that we know it's not the ideal, but nobody can say that out loud. And so that felt a little disappointing, and it definitely does feel like it shakes my confidence in future recommendations, just not kind of knowing what to believe. But in terms of future recommendations and like what should we do, what should be done, what I see just from my own little bubble is, you know, really wishing that there was just a better, more streamlined universal response, right? Like looking for whether it's federal, even just statewide, but instead you just have these like both competing states and then competing hospital networks within that. It's just ridiculous. But, you know, some places, smaller community hospitals, states where the leadership is not taking it seriously, you know, are maybe going to be in more trouble for it.
Well, tell me, Helen, what else do you have on your mind? I know you're having a lot of conversations, and I know this has affected you greatly. What sort of closing thoughts or suggestions do you have?
Well, I guess I would want to just speak to you a little bit from a perspective from which I think I have more expertise even than a healthcare provider, since I, you know, haven't been directly caring for patients with this condition, but more so as my experience as a parent and my concerns as a parent moving forward. I'm very concerned about how states and municipalities are going to handle school this fall and even for the whole year. Nobody knows yet what is going to happen. Nobody quite knows what the rates are going to look like for the fall. We know there's not going to be a vaccine in the fall. Right? I mean, COVID's still going to be around. And this current situation of schools being closed and kids being, in various states of at-home schooling and remote schooling is absolutely not sustainable. It is not sustainable, and it is harmful to our families and to the economy and to our children. And I hear schools kind of grappling with kind of how to be creative and distance and have the kids wear masks and maybe do like half days or AB days and all, like making sure people have computers so they can do online learning. And there's just so much that people aren't thinking about. And you want to get people, it's all this talk about getting the economy going. The parents cannot do this. Like, we cannot do our jobs remotely and also help our kids, homeschool our children. Like, it's not a thing that will continue to happen. And to think that, that's just can't be a default for next year again. And our kids are suffering because what they really need from school is the socialization and the interaction. And it's very difficult to figure out how to provide that for your kids sitting in front of a screen in a Google Classroom where they can see pictures of their friends but not interact with them does not count. And I'm very concerned about what we do. And at the same time, I take very seriously that we don't know about how the waves of this pandemic can roll, that fortunately kids are not hard hit like they might be with other conditions, but we know that we can all be carriers and vectors. So I know that having school be the way school isn't necessarily a good thing, but what we have now is not working for families at all, and it's not working for kids at all. And yet I feel like I don't hear much conversation at all about it. We're figuring out how to open up restaurants, and listen, people are suffering and they're going to lose their restaurants and lose their jobs and lose their incomes. I get that. But man, I would much rather have, I don't know, a couple $1,000s sent to every family, every person, so that they don't have to worry about their jobs right now, and put a ton of our resources into figuring out how to keep educating and socializing our children. And worry a little bit less about retail being open. So that's my rant.
I don't think that's a rant. I think you bring up fair points, and you remind me of a couple of follow-up questions. One, and I meant to ask this one earlier, but what are some of the things you're hearing from people who really don't know the ins and outs, and perhaps some propaganda from folks with an agenda? What are some of the things you're hearing that are really making you feel frustrated, if not angry? What do you want to say to the people who you mentioned earlier the partisanship, and speaking as someone who strives for bipartisanship, sometimes it feels like there are certain people on the left who are almost willing to let the economy go to zero to save one life. There are people on the right who are almost willing to let everybody die to make $1. And of course, those are the extremes. That's not the consensus position. But I know you've heard a lot of things that have left you shaking your head. I wonder if you're willing to share some of those thoughts.
So I think I tend to be someone who really tries to understand where people are coming from and be empathetic to views even when I disagree with them. And I do feel like I understand how crazy it must seem to have the restrictions that have been recommended and in such a universal way, when many communities don't feel the impact. So I say this specifically to people that don't live in urban centers, right, and are seeing like small numbers or maybe no numbers in, more rural states or different parts of, maybe one part of Maryland, like it's a little farther away, that maybe doesn't have as big numbers, and sort of feel like, well, why do I have to follow the same things? And I guess what I would say to that is, first of all, our boundaries are artificial, right? Our state lines and our county lines are like, we're a mobile society. Nobody's closed down borders, like you never know. It doesn't take much for travel and commerce for viruses to spread, because they do spread, and we know this is a virus that spreads pretty easily. But the other thing that I would say for people who feel like they're away from the cities and the cases are low, is that then those are areas that don't have as many hospital resources. So, you can feel safe in an area of the country that's a little more rural and has, just a little less density. And there's ways in which that's going to keep you safer, because you're able to social distance as part of, your lifestyle. But how many ICU beds are close to you, right? And what's the staffing like at your hospitals? We have a pretty bad crisis of primary care and hospital beds in a lot of rural areas of our country, like as it is. So I really, worry about states, which then also that tends to be like our cultural political divide, that tends to be more red states, right? That are maybe then also looking at news sources or looking at sources or being more kind of skeptical of certain voices, where then they're also thinking it's not a big deal. And so they're doubly not taking things seriously. And I really worry about how those communities will end up getting hit.
So to your point earlier, I've seen that quite a few rural hospitals have either already closed or are at risk of closing. And if the waves hit, which we all agree, the lower the population density, theoretically, the less quickly the virus can spread.
Mm-hmm.
But in these under-resourced areas medically, where hospitals are already closing, hospitals
Mm-hmm.
are teetering on the edge of bankruptcy,
Mm-hmm.
it is very concerning that if a
Yeah.
wave hits, there's just no way that we'll be prepared. And
Yeah.
then I'm also curious on testing. A friend of mine's a doctor on a Navajo reservation, and she says that the testing is a joke in terms of the accuracy, that we're still getting, not only do we not have enough tests, but a lot of the tests aren't reliable. We're getting not just false positives, which can be corrected through a second test and a third
Mm-hmm.
test to drive the percent of it being false way down. But I'm hearing that we're getting quite a few false negatives,
Mm-hmm.
which is a much bigger problem.
Mm-hmm.
Are you hearing and seeing those same things?
Oh, absolutely. I mean, that's my understanding of that. There's quite a range in, there's not just like one coronavirus test, right? There's different kind of companies and formulations, and even testing techniques. Up in New Jersey, Rutgers developed a saliva-based test, which is awesome. I'm not an expert. I don't know the details of what tests are better or worse with the false negative rates. And part of the testing issue, though, is a function of, the deviousness of this particular virus. So, if you're doing asymptomatic screening, where you're testing someone to try to, make sure that they're okay to have an elective procedure or, hang out with the president, someone might have been exposed to the virus but not be shedding yet, right? So you can have this sort of you did it too early kind of false negative. And then you can get false negatives just related to sampling or how much, whether or not you kind of caught the virus. And so it doesn't, because there's this bit of a lag of, 5 days or more from acquiring it from somebody to developing symptoms. The tests are much more accurate when people have symptoms is what I've seen, although there's still variation in the types.
That's about all I got on my end. You got anything else you want to add?
No, but it's strange to have a conversation with you that I'm not yelling at you more. So that was fun. You really watched yourself there.
What's strange is that I kind of enjoy being yelled at. So I guess next time I'll have to do.
You're not saying enough controversial things, Pete. This is too tame.
I earnestly do want this to be a show that people can count on for as little bias as possible.
But be careful not to fall into the trap of both sides in things. Sometimes there's just facts. Sometimes there's just reality. So, when it comes to something like how we deal with a healthcare crisis, like, we should listen to different people's experiences of it and concerns and ideas, but it doesn't mean that we get to have multiple different versions of reality, So, if a particular political side is picking a different version of reality, then we need to be able to call that out and sort of saying, well, he said, she said, and this side, and treating it like they're both equal. Sometimes that's not the case. So that's my advice to you.
Let me give you a great example of that I think will illuminate the purpose of this show. Okay. You look at family separation at the border, right?
Mm-hmm.
And many on the left said this is horrendous. This is similar to Nazi Germany, right? And many on the right said it's the same thing Obama did. Well, I'm not in either one of those camps. The truth is that in terms of unaccompanied minors, the policy didn't change. And the Obama administration placed unaccompanied minors in improperly vetted households and essentially lost track of them. And that's not okay. And that policy is the same as Trump. What's different is that Trump and Sessions desired to use small children as a deterrent to send a message to would-be immigrants or refugees. And so Barack Obama's administration only separated small children when the parents committed an aggravating additional crime beyond simply trying to cross into the country illegally, like stuffing a bag of heroin in a diaper bag. Whereas the Trump administration pursued a blanket policy of family separation as a deterrent. They literally used 2- and 3-year-old children as a political prop to scare the next wave of would-be immigrant families from coming, right? And so that's when I say the bipartisan brief, it's not an all sides thing. It's a truth thing. What the Obama administration did with unaccompanied minors was not okay. It's the same thing the Trump administration did with unaccompanied minors, which is also not okay. But what's different is the Trump administration blanket policy of family separation, which is substantially worse than the unaccompanied minor policy that both administrations pursued. So don't worry. I'm not going to be an all-sideser who just draws equivalencies. I'm going to do the best I can to tell the truth based on multiple sources and trying to get to the bottom of things as well as I'm able to. Does that make sense?
Sounds good.
I appreciate you so much, Helen.
Thank you, Pete.
Okay, bye-bye. I'm joined today on the Bipartisan Brief by my friend Bobby Hood, who's one of the only people I know who's been paying very careful attention to the data and is himself personally a COVID-19 survivor. And I want to begin there. Tell us about your experiences with this disease and try to help us understand it better.
Well, I mean, it's just, I guess it's hard for everybody to describe because it's such an individual thing. I mean, my girlfriend and I, she was working at a retail store in Dallas and early on in the pandemic, middle of March, and she, during during the last week before they started shutting everything down, we were out once or twice, in public, and she was working. She was working at a retail store, interacting with the public, and there were lots of people out there in Dallas that week leading up, and that Saturday that was the celebration of St. Patrick's Day, and somewhere along the way, she or I got exposed to it, and about 3 days later, we started feeling the effects. And at first, I just was, I was trying to ride my bike around White Rock Lake, and I was suddenly feeling super exhausted for no reason, when normally I could ride for several miles with no problem. And then within a couple of days, just even walking across the room or talking a few sentences would get me super out of breath. And at that time, we kept talking to doctors and calling phone numbers, and our symptoms weren't serious enough to take a test. They wouldn't let us take a test. And so all the doctors and everybody we could talk to said was just stay at home, and unless you get to where you literally cannot breathe, then just stay at home and take care of yourself. So that's what we did. And so for a period of about 17 days, we felt mostly okay, but every time we moved around or did anything, we suddenly were super exhausted and out of breath. Felt like there was just pressure on our chest, like somebody was pushing on our chest with their hand. And fever would come and go, and just felt confused, because when you can't breathe deeply, you can't get much oxygen to your brain, so you can't think very well. It made tutoring. I tutor students for the SAT and ACT. It made tutoring very difficult. But that's it. And so we had, what the CDC would describe as a mild case, and that's mild. You can't do anything for 14, 17 days. And so we just stayed at home, didn't leave, waited for it to leave. And eventually, finally, one night, we both felt really bad for a couple of days, and then kind of sweated it all out one night. And then we felt fine after that. We felt fine ever since, for now a month and a half or so.
Are there any, you hear it compared to the flu regularly. Are the symptoms similar? Was there vomiting? Was there excessive sweating? Were you running a high fever and that type of thing?
So, I've had the flu before a few times in my life. It is I think there are lots of different ways that this can present for people. But for both of us, it was absolutely unlike the flu. Because with the flu, you feel terrible, you're shaking, you're shivering, you're really hot, you have a high fever, you get under the covers, you can't move, like you said, you're throwing up, you're in the bathroom all the time. We didn't have any of that. We just felt completely exhausted and out of breath, and would have temperature a lot. Like our temperature would vary from high temperatures to regular temperatures. In the morning, I'd have 102-degree fever, and then in the afternoon, I'd have a perfect 98.6 fever, and then in the evening again, I'd have 101-degree fever. It didn't make any sense. But that's the mild version we had. I think there are versions that can feel more or less like a flu. I think if it had been 50% milder for us, it would have just felt like allergies. Like, oh, I can't breathe very well this week. I'm coughing. I have this weird, dry, raspy cough, and that's it. We had it that plus every time I would try to say a sentence, or if I'd bend over to get a can out of the cabinet, I would be out of breath for half an hour. And that's the thing that's unlike anything I've ever experienced in my life. It was crazy. But otherwise, I kind of felt okay, which is completely unlike the flu.
That is. And let me ask you this, because I've read elsewhere that if not the symptoms linger, just kind of the effects of the disease linger. Have you had difficulties moving forward now that you've technically recovered?
Yeah, in the month and a half since, it took a long, long time for energy levels to get back. And I guess now that it's 2 months out, I'd say I'm 95% completely normal, and so it either 100% or 95%. But for a long time, I think it just makes you nervous when for 3 weeks you can't breathe right. You restrict your activity so much. I don't know, but yeah, and then you're worried. that it's going to come back, and so you restrict yourself so much. There is a pattern, at least with the mild, and I think it is with other things. What happens is, you're feeling terrible for about a week and a half or so, and then it seems to go away, and you think, oh, okay, I'm done with this, great, and then you start behaving normally again, and then suddenly, after 2 or 3 days of thinking you're perfectly fine, it hits worse than it ever started. And that's when your body has, from the reading I've done, that's when your body has actually figured out how to actually fight it. That's when the white blood cells are actually like acting, and trying to fight the infection. And that's when, if things are going to go wrong, it may be at that point where the white blood cells start attacking the wrong things. And that's when the white blood cells start attacking your lungs. And that's when you go to the hospital and you're in deep trouble. But so in our case, we thought we were well, and then suddenly it hit, and we said, oh no, this is worse than it was. And that lasted about 3 days. And then suddenly, finally, for the first time ever, we started sweating and shivering for a day or so, and then it cleared, which is really weird. But I have some friends who live in Spain and in Italy, and they had already been through it personally. And so I was constantly talking to these people who had 1 month earlier in February been through it and had mild cases. And so they just kept telling me, what you were describing is exactly the same thing that we just went through, and my family went through it, and my brother-in-law went through it, and my sister-in-law went through it. Everybody went through it, and it sounds exactly like what you're doing. So just wait it out, rest a lot, move around some, stretch, all that stuff.
Well, so I've read that, at least in some cases, this disease affects parts of the body that are sort of being underreported. Like, we know it's a respiratory disease, but I've read that it wreaks havoc on the kidneys and other parts of the body. Mm-hmm. Have you had tests and blood work to see if the rest of your body has fully recovered and is doing okay?
Not at all, because there was no there was all of the system. Like, when we said, hey, we want to take a test, they said, county won't give you a test, your symptoms aren't strong enough to take a test. And then finally we got kind of desperate, and we called an urgent care to go sort of place that now I realize is not very well regarded, that came out and sent someone to our house and charged us a whole bunch of money to give us a test. And then she administered the test, and she just took a swab and put it in our nose about right here into our nose, and tested us. And then 3 days later, that test came back and said it was a negative. And of course, there's all these reports that there are 30% false negatives on these tests. But then I talked to people about how you administer that test, and the swab is supposed to go all the way back into your nose, back to the back of your throat. This is way back at the very beginning of all this stuff. So the only test we could ever get anyone to give us was a hugely expensive test that was not approved by the FDA, that was given by some weird fly-by-night place. When we called back to complain about that, they said, oh, that technician we sent out to your house is not employed here anymore. And so we don't have even the positive diagnosis that would allow for us to go and say, hey, test us for all these things. Because when we talk to our doctor, she says, oh, do you have, our GP, she says, well, do you have a positive diagnosis? No, well, then if you don't, then there's no reason to test you for anything because you didn't have it. And we say, well, we clearly had this thing that's unlike anything I've ever had in my life, and it lasted 21 days, and, or whatever, it's very clear. But so, yeah, but physically we feel completely fine. And from whatever, so physically we feel fine now. But yeah, from all the articles I've been reading and all this stuff, it does certainly seem like that this disease does a whole lot more than just attack the lungs. And so I think when it's all said and done, they're probably not even going to call this a respiratory disease when it's all done.
Well, it'll
be systemic or something.
I definitely will stay in touch and follow up on that topic once you get all the blood work to see. Because it seems like we don't exactly know yet. Like, do the milder cases affect the kidneys, for example, versus the severe cases? It seems like we don't necessarily know. So I want to transition to data, because I know you got to run here in just a second.
Sure.
I've been paying very close attention to the data, more so than really anyone else I know. And I'm just curious to get your general thoughts nationally, globally, locally, as well as try to help us understand what we're missing. Because your projections have been a lot closer to right than the official projections I've been seeing. So I'll just turn it over to you, and
Sure.
please let us know what's up.
Well, yeah, I mean, this is all just so fascinating. I mean, I originally was doing projections because I was just saying, okay, if we take the last week of, what the numbers look like, what does it look like the numbers will be for the next month? Well, they're increasing at this rate, average that together. Well, it looks like it's going to go up a whole bunch. That seems very simple and understandable to me. Is like the numbers are going to keep going up unless we change our behavior. And also, if we see that the numbers start going down, maybe then we've crested that first wave, right? Because at the beginning, everybody was saying we were going to have a wave, and then that wave was going to end. And so I was running numbers and making projections saying, okay, if we go above the projections, then we haven't changed our behavior, we haven't flattened the curve, and the wave hasn't ended yet. If everything turns and goes down, well then, okay, we did flatten the curve and now the wave has ended. But what has happened is that, like, overall, the answer is we did something in the middle of those two things. We're still in the first wave. We kind of flattened it a little bit, and we're just still sitting there in it. And every day there are, however many, new cases every day. There are however many new deaths every day. And in the United States, I mean, just like pulling that up, like, the U.S. is cruising along at 1,000 deaths a day, approximately, right? And 20 to, somewhere around 20 to 25,000 new cases a day, the most in the world. And so the wave went up, and then it just is sitting there at about 20,000. Well, that's not a wave that crested and went down. That's a wave that crested real high and then just flattened out at 20,000. Well, we were wanting to flatten the curve down real low, and instead what we did is flatten it or something way up here, and that's not where we want to be, right? And so we're still in this first wave, and too many people are continuing to die. But now, through just emotional and mental exhaustion, everybody has, like, just given up on even talking or thinking about it, right? And so the U.S. is now 25% or something of the cases in the world, and the deaths in the world are all in the U.S., right? And so that, I mean, that's the insane thing about this, right? Is that we are still generating those numbers, and now they have the IHME projections now say, which is that the IHME is that group that does the studies that are the projections that the United States has been sort of basing its behavior on. And so they're now saying that we're going to hit 170,000 deaths in the U.S. by October. They were doing all their projections for August. Now they've started doing it for October. And so, back, you remember at the beginning, they were saying there'd be no deaths. Then they said, well, if there's less than 100,000, that'll be a victory. And then suddenly we broke 100,000. They didn't really say anything about that. And then suddenly the projection was 135,000 dead in the U.S. by August. Now it's 170 by October. And yet my projection right now, based on what the U.S. is, my spreadsheet is saying, will be at 170,000 deaths by the beginning of September. So that's still at least closer, right? So that's 3 weeks off, so the IHME is at least now projecting similar, still lower, but similar. But anyway, the last answer to all that is that what it seems like everybody's saying, including the IHME, is that we're going to rock along on this flat thing and keep having about 20 to 30,000 cases a day in the U.S. and about 1,000, maybe 600 deaths a day, somewhere in that range, all the way through probably July and August. And then somewhere around September, mid-August, September, that's when the second wave is going to begin to hit, and it's going to start going up really sharply. And, that's interesting, that 170,000 deaths projected by October 1, if you go to the IHME webpage and you look at it, it's got this graph, and it shows, this spike happening, right? And the numbers start going up, And then right at October 1, they just cut it off and say, here's our projection of the total deaths by right here, where you can see the spike in deaths going like that. And you're like, oh, what a convenient time to cut it off right as the second wave is hitting. So if the projection is we're going to hit 170,000 deaths right here, right? And then you cut off the projection right there, but the spike in deaths is going like that. Well, yeah, we're going to be looking at, just like in the 60s with the flu pandemic that happened in the 60s that nobody even talks about. The 1960s,
the Hong Kong,
yeah, which was people referred to back then as the Hong Kong flu. That had 2-3 million deaths, right? And that was 1968, the summer of love, right? Everybody's focused on Woodstock, and nobody paid any attention because there were all these protests. There were all these protests against racism and everything else happening, and civil rights. Everybody kind of missed, like, there were 2 to 3 million deaths, and that was the original projection that this whole thing was going to be.
You mean globally when you say 2 to 3 million deaths?
I think that, yeah. What was the?
It was not 2 to 3 million deaths in the U.S., I believe.
Yeah, let's look and just see what. Just to confirm that, and then we can wrap up. And this is a conversation that we should continue, right?
For sure.
Let's just look at that real quick, and then, yeah, I'd like to get that number because I don't want to have anything that's, yeah. So,
yeah, I projected, my own numbers projected several months ago, we were going to be between 75,000 and 250,000 deaths in the U.S. And now, unfortunately, it's looking like we're pretty clearly going to go above 250,000. I assume your numbers are saying the same thing.
Yeah. So, yeah, I mean, I think I'm expecting we'll see 200,000, 250,000 in 2020 for the U.S. And yeah, looking at that 1968, the CDC said it was 1 million worldwide and somewhere between 35,000 to 100,000 people in the U.S. But those numbers are it's always hard to count those things. But anyway, this is fascinating stuff. We need to continue this absolutely another time, but I do need to run to go tutor a student.
Well, Bobby, I really appreciate your time, and we definitely will do a follow-up because we did not quite have enough time to cover your personal situation and the data. But we'll do a follow-up in the next couple of weeks. And,
oh, man. We can always talk about that stuff. Oh, there's my
and thanks again for making some time for us this morning. And we'll
absolutely.
Okay, Bobby. Cheers.
All right.